So, good morning, everybody. And, I was just saying to Dr. Whalen, we're hoping not to see each other till Monday. And, unfortunately, trying to decide what numbers we put out, how we're going to go forward with this. Now, the second wave's here. It's here. We're in the middle of it. But just, I know it's been 38 weeks. It's been almost 9 months. I know people are tired. But the reality is our numbers are going up. And they continue to go up. And it was alarming when I watched the news last night and I was watching everyone shopping. And they had masks on, which was good. And people felt they were staying 6 feet apart, which is good, doing the right thing. But sadly, last night, 6 more Albany County residents lost their lives to COVID-19. All but one were not from a group setting or a nursing home. We lost a woman in her 50s, a woman in her 60s, a woman in their 70s, and a man and woman in their 80s. To the 6 people that lost family members yesterday, my condolences, my prayers go out for you. And I know it's a difficult time, especially with the holiday and losing someone like you did, and to all the families that lost a loved one during these difficult times. It's not easy, and I hope no one has to experience that. But again, to lose 6 residents overnight, it's alarming. It's very, very alarming. And I hope people are waking up and realizing that COVID-19 is here. We can't have fatigue, and we have to be more vigilant now than we've ever been before. I said it yesterday, we're setting records for the month of November, and I don't like the records we're setting. We got to continue to work in the right direction in a partnership and be there for one another. And we'll get through it. That brings our total death toll now to 157 in Albany County alone. We had 9 deaths in just 1 week. The last time we had 6 deaths to report one day was back on May the 4th. So to look at the numbers that we go through and dissect, it's looking worse now than it did in the beginning. And with the people passing away, the spread of the virus, yes, there's more testing and everything else going on, but we're there. We have 5,558 positive cases of coronavirus in Albany County to date. 2,311 people are currently under mandatory quarantine. We have a net increase of 67 positive cases overnight, which is better than 100. But then again, let's remember, not everyone was working full-time yesterday. It was, so that probably had a lot to play into it going forward. And, hopefully the numbers don't increase, but I'll live with 67. Of the new positive cases, 15 have close contact to positive cases, 1 healthcare worker, 51 don't have a clear source of infection. So as of today, we have 22,740 people that now have completed quarantine, 4,643 people tested positive for the virus, and 109 recovered since yesterday, which is good news. Sadly, we once again had shattered our previous record for the number of people hospitalized, in part because of a new system that's been put in place that ensures we're getting timely, accurate data from our hospital partners. There are now currently 61 people hospitalized, up from 43 reported yesterday, an increase of 18 new cases. Our previous record was 45, set on November the 20th. There's been now 519 total hospitals ever, an increase of 45 based on reconciliation with Albany Medical Center. And Dr. Owen will discuss this further in her comments. Our hospital rate is now 1.09% of those who have been tested positive. Yesterday, the rate was 0.78. 6 patients currently in the ICU. Yesterday, the number was 10. Over the last 5 days, there's been an average of 103.4 new positive cases. The day before was 99.2. Looking at our percent positive rate, Albany County 7-day rolling average has now hit 3.6% as of November 26th. That numbers jumped after Albany County reported a single percent positive of 5.6 2 days ago, with the most recent data that was put on the New York Forward dashboard. 10 days in a row, like I said before, will qualify us for a yellow microcluster zone. And though I keep reminding everyone that the state will likely look at individual locations, zip codes, and break it down, we won't know until they tell us how they're going to do it with their data. But the capital region as a whole has a 7-day% positive average of 2.64%. Of that day was 2.37%. There's some things we can look at, just to put this in broader view. And, again, not trying to scare people. I know people are out there saying that, we're trying to fairmonger, we're trying to scare people. Yeah, please, I'm begging you, please, do the right thing. Stay 6 feet apart, clean your hands, cough into your arm, wear your mask, and we'll get through this. So if you take anything away from this, we're just putting this stuff out there. And Dr. Will and I, for almost the last 9 months, have been as transparent as we can, putting the information out there as we get it, as long as it's being transparent to us, the information we're getting. What you do with it from here is up to you. How you take that information, how you want to act, whether you want to believe in it, not believe in it, wear a mask, not wear a mask, come up with your own science, that's up to you. That is totally up to you. But just to make some of the numbers in line, heart disease represents more than 650 deaths per year. Cancer, 599 deaths per year. Accidents, more than 167. Stroke, 147 deaths. And I could go on. To date, there's more than 263,000 people that have lost their lives to COVID since the outbreak started in this country. Every hour, an estimate 65 Americans die to the coronavirus. 65. For those who don't think COVID is a serious issue and don't think accidental deaths, strokes, asthma are serious issues, I don't know what to tell you. I don't. I'm not trying to scare you. I'm just trying to educate you. You want to get smarter? Read books. Read books. There's nothing wrong with getting more knowledge. But let's have an intelligent conversation. Get the facts straight. Look at all the information that's out there like we do, and you can decide. But I'm telling you, numbers don't lie. If we do everything in our power to stop people from dying from those horrible things, and we have a vaccine coming out, we're almost there. We need to work together in a partnership to get through this, and we'll get through it if people continue to do the right things. The people doing the right things out there, thank you. I do want to say thank you. It's just the bad behavior of a few people that are making this worse, that aren't taking it serious, that have COVID-19 fatigue. Please, it's a serious issue, just like everything else is. Suicide, drugs, overdose, so forth and so on. I can continue on. I'm not here to preach to you. I'm just here to give you the facts, and hopefully you do the right thing and take the advice of Dr. Whalen and myself or any expert that's out there. Please, just do the right thing. So we will be setting up our mobile testing sites this Friday, December 4th, between 1 p.m. and 4 p.m. through a partnership with Whitney Young at our Times Union Center. It's getting colder out. We want people to be able to walk up, get testing. It was successful when we did it last year. So please take advantage of it as it gets colder out. We have to start coming up with different locations so people can get tested and stay warm, while they're staying 6 feet apart. You can call to make an appointment at 518-465-4771. Again, we cover the cost. Costs you nothing to go through Whitney Young if you don't have insurance. And as always, people, please, you can go to UAlbany and go to our Albany County website and see all the locations that you can go to. UAlbany, Price Chopper, CVS, Purdy One, Walgreens, plenty of others. We can go on and on, but they're there. Just go to the website and you can find out where they are. And please. It makes it easy, and it tells you where you can go with kids, where you can go with, drive-through testing at Albany, it's been there. You can call. You can continue to go out there and get a schedule. Albany's 1-888-364-3065. And, please avoid large gatherings, wear masks, cough into your arms, clean your hands 6 feet apart. Broken record. Dr. Whalen.
Good morning. So I think when we look back on November and the numbers that we've seen, we are recognizing that November was a dark month, and it has positioned us, unfortunately, very poorly for the upcoming holiday season. People need to be mindful. People need to know that this could get a lot worse before it gets better. As we just heard, we have been working very closely with our hospital partners on improving systems of data collection around hospitalizations. Real-time data, as I've indicated many times in press conferences before, is a difficult prospect when you're dealing with large numbers. We have patients going into the hospital, and we become aware of them when they test positive, which isn't always the first day of admission. So we worked with our hospital partners to try to implement a better collection methodology, which we started to get data back on this week. And we've noted particularly an uptick in hospitalizations over the past week. This is concerning. This means that people that have COVID are becoming more ill. And as we always discuss, when we see more hospitalizations, we have the concern around surge capacity and the capacity of our hospitals to be able to take care of people. We see incidences of surge capacity affecting patient care in other parts of the country, and we do not want that to happen here in Albany County. We have excellent medical centers, we have excellent medical personnel, but as the risk of COVID increases in the community, and as we start to see people becoming more ill, the risk is that our hospitalizations will go up and that they will test the capacity of the system. This is historically a month where people do a lot of socializing and getting together, and we're asking you to do that differently, not to do it this year because of the risk to you and your family. We've stressed the importance of this around the Thanksgiving holiday, but as we have said daily, what you do now will influence what happens here in the coming days and weeks, and we cannot afford for things to get worse. It is essential that people get their flu shots. As we start to come into December, we worry about the rates of flu picking up, and a flu shot is the single best thing you can do for you and your family to prevent you from getting flu and to prevent flu from becoming severe if you do contract the flu. This is very important as we're dealing with a pandemic, and we cannot bear the additional burden of hospitalization of influenza patients. So please get flu shots for you and your family. We know that the coronavirus vaccine will be available, but again, the timeline is the question mark. It is likely that we may see doses in as early as 3 weeks, but again, these will be released in a tiered fashion, and it is unlikely that these will be available to the general public until late spring, potentially early summer. And I'll be very happy to update that sooner if I'm able to at any time. But this message is important because it tells people the timeline for how long we need to continue wearing masks, how long we continue to need to stay home when we can and avoid socializing. These are small sacrifices to make to protect the health of your family. For those people that have had loved ones in the hospital, they know what a terrible sacrifice that is and how hard that is on families. And for the families that we discussed this morning that lost individuals, there are situations in which this can be prevented, and it can be prevented by you. So please do the right thing. Stay home when you can. Work remotely if possible. If you have children in school, please ensure that out of school hours they are not socializing with groups of kids. Ensure that they continue to wear masks. Ensure that You are taking care of your family in the best way possible by preventing them from coming down with COVID-19. We want to see the hospitalization numbers and the case numbers decrease. We know in all likelihood that the numbers that we're seeing are underreporting of what is actually in the community. We know that there are many people that have COVID that don't have symptoms, and this is the danger to the general public. This is one of the reasons why COVID-19 has spread so rapidly across this country. You can become you can spread the virus 2 days before symptomatic. You can spread the virus if you have it and you're asymptomatic. Unless we are testing every single person in the general public twice a week, we don't know the current rates. We don't have the ability to do that currently. So what we need to do is ensure that everyone is taking the appropriate precautionary measures going forward. We don't want to be sitting here in a month talking about numbers that are much higher than now. And if you look at the trend data, we are on track to do that. So please do the right thing.
Thank you, Dr. Whalen. And again, to the 6 families that lost loved ones, our condolences and prayers go out to you and to everyone, to the 157 families. Please, pleading with everyone out there, do the right thing and we'll get through this. And we can get through this. You know, we're resilient here in Albany County, in New York State, and we can build off of this for our future, but we need you to do the right thing, especially the kids in that age group that identify between 20 and 29-year-olds. Get tested. I know you feel good, but get tested, do the right thing, stay away. And I'm afraid what happened on Thanksgiving with families getting together. The next few days will be telling to us to what's going on here. So please, to everyone doing the right thing, thank you, thank you, thank you. If you need mental health support, it's available 7 days a week from 8 a.m. to 5 p.m. And the number's 269-6634, our 24-hour sexual assault hotline number, and 211 in the New York State hotline. So please, if you feel uneasy with the situation, you want to talk to somebody, it's available. Same thing with your children. I've said this before. It's harder on kids, even though they are resilient, than you imagine. Just take the time and speak to them. Take the time, speak to them, and make them realize what's going on around them. And we learn from this to move forward. But again, please be safe out there and do the right thing.